if you look into the government sectors, there are a lot of emerging trends in the form of achievements. If you look the achievements, there are definitely, if we took up the programs, different programs, there are definitely very good achievements in controlling and some of the eradications programs like polio, TB, leprosy, measles, diphtheria, jaundice and many other diseases. The government sector has done a very good work in this particular fields. There is a lot of improvement in the infrastructure facilities, which is also helpful in the diagnosis and treatment. There is a better availability of the good and modern equipments and instruments. There are usually no shortages of the medicines in the government sectors anywhere, right from the primary sector to the every level, up to the medical college level also. There is a system of giving the lots of funds and their utilization up to the village level. So the utilization of the fund in the government sector is maximum after the involvement of the or the introduction of the NRHM.
Actually, we are catering the middle class people. So the challenge is this, that the treatment should be good, advanced, modernized, but it should be at a cheaper rate so that we can cater more people. Some of the commercialized banks, some of commercialized hospitals, private hospitals, they are charging enormous amount. Suppose in ICU, they are spending about 20,000, 30,000 rupees per day, which common people cannot afford. So we are catering the middle class people, and we are situated in the center of the town. Of course, our is a charitable trust, but we are charging at a reasonable rate. So first thing is this, how many people in India can afford such a high cost of medicine and such a high cost of treatment? So that is the main burning issue. In India, people are not having meals 2 times. And these courses are very
healthcare sector, sir. The major issue in our, especially in our type of healthcare, is the spending on health is not increased in spite of such an excellent program. And hospital management is, because the number of hospitals are increasing, there is a huge scope, and you need people who can manage hospitals, because hospital management itself is a specialized thing, and to have such a thing, it's a great thing.
As a hospital CEO, I should focus on the quality aspects. If I will provide the quality in terms of patient services, in terms of patient's relative care, so that will give me the purpose. See, we are always in short of the healthcare administrator, healthcare people. So it is a very nice beginning, and I must say that it should be in a large scale also.
5 or 10. I think isolated or private practice will be a question mark. Multi-speciality hospitals and group practice and corporate hospitals is only a future. So in that case, people like you, the course which you are doing, it's very much required to maintain this type of setup, because in this setup, doctors can only have a vision of medical practice. Management is something different. So it is required. Either it removes the problem of society or not, that is a question.
Because I thought you people are smart people and you know exactly what you want, and you are here to gather different experience, and I'm sure this will, when you put and digest it, you will put into practice. How people get ignited, like Abdul Kalam says, is different, you know. So how you will get stimulated? Maybe by coming here, some of you might get stimulated to do it, in this way and duplicate this type of experience elsewhere. That's what we want. I'm very happy to see, because today our nation depends upon the young people.
What I feel current issues would be providing quality care at affordable rates. Like we have got very good setups, but it's very expensive. Many of our people cannot afford this. So providing good care at affordable rates is indeed a major challenge for us. Absolutely, like hospital management is indeed different specialties, subspecialty, where a medical person or somebody who gets specialized into hospital administration, if that person manages the hospital, it makes a lot of difference. Because as a specialist, we can concentrate on our scientific job, and if somebody else who is a qualified professional, if he manages the hospital, that is the future, and that's what we do basically.
See, there is definite need of hospital administrators. One, so far the things are changing in this medical field too. Earlier what used to happen, a doctor who would graduate or postgraduate or postdoctorate would have his own nursing home. And he will be all in one. He will be a doctor, he will be a manager, he will be an accountant, he will be an administrator, he will be everything, the marketing guy. Now the things are changing. Let's say now doctors, I guess, should restrict their work only to a professional core. They should deliver only their professional services. Consultants, especially doctors, should not interfere or involve in day-to-day running of a hospital. That job should be left upon to a hospital administrators. So n number of hospitals are there, and so is n number of posts for hospital admin guys are there. And there is definitely
especially in North Gujarat, facing double trouble of diseases, we are yet to control communicable diseases, and at the same time non-communicable diseases are steeply rising. So that is our first priority. Secondly, now we are having on and off pandemics occurring in our region also, like H1N1. We are having problems of zoonotic diseases like CCHF that has recently occurred in our district. So we have to control diseases that are prevalent in our region, and we have to take care of newly emerging diseases that pose potential threat to survival of people. We at district level are very happy to note that state of Gujarat have decided to send young dynamic officer for Master of Hospital Administration, because we perceive that today doctor's role is not limited to provide clinical services, but they have to take care of day in day out managerial issues also. We perceive that our doctors are now a CEO of a bigger institution because we are having lack of trained manpower, and whatever manpower we do have, that has to be utilized to their utmost potential. And for that, if the doctor is trained in an administration aspect, if they know how to manage people effectively, then it will be of great help to our present system. So I really commend the step of government of Gujarat, and we hope that our doctors, after graduating from this institute, will be a great asset to our system. Thank you.